Having washed your hands, begin with a clean, well-stocked trolley. Check your request form to determine which sample bottles are required, and then begin to prepare all your equipment. Make a final check before approaching your patient. Approach your patient in a friendly manner, introduce yourself and explain that you'd like to take a sample of blood and why, to gain informed consent.
Yeah, that's fine. Okay, can I just start by checking your details, please? Can you just tell me your
Use your request form to check and ensure that you've got the correct patient.
364. That's lovely. I'll just check your unit number. Okay, that's lovely. Right then, I'll just get organised.
And then begin preparing your environment.
And I'll just come round. Okay. Okay, can I just have a quick look at both of your arms?
Make a visual inspection of both of the patient's arms to determine which arm you're going to choose to take the sample of blood from, and then begin making your patient comfortable.
If you just make sure your arms.
Ensure that their arm is well supported on a pillow.
That's lovely. I'm just going to pop that.
Place a disposable tourniquet under the patient's arm.
And then I'll just put those on and get everything ready.
Use non-sterile gloves.
I guess you've had your blood taken quite a lot while you've been in hospital. Quite a few times, so you've got used to it. Almost. Okay, I'll just get this ready.
And then begin preparing the equipment you've selected to use, ensuring you do not contaminate any key parts. Begin palpating the patient's vein to identify a nice, straight, soft and bouncy vein. Ensure you know the direction the vein is going and sit in line with the vein. Also palpate the brachial artery. Clean the skin for 30 seconds. While the skin is drying, make a final check of your equipment. Ensure that the bevel edge of the needle is uppermost. Anchor the vein with the thumb. Insert the needle smoothly and confidently. Attach the sample bottle to the vacutainer body and ensure that blood is bleeding into the sample bottle. Keep your right hand steady. Release the tourniquet once the sample has been obtained. Remove the sample bottle and invert the sample. Place a piece of cotton wool over the site once the needle has been removed. Ask the patient to hold onto the cotton ball and label the sample at the bedside. Check to make sure there's no bleeding. And apply a piece of tape. Ensure your patient is comfortable at this point. Review the environment.
Thank you. Thank you.
Dispose of all equipment appropriately. And finish by washing your hands.
First thing. Sorry, it took the cable. Come on.
From the same angle.
Sorry, we should have had a driver.